Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
A mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMCTV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Samuel Moore. He's an orthopedic surgeon and president of the Arkansas Osteopathic Medical Association. Dr. Moore, thanks for being here today.
Thanks so much, Robin, for having me. I'm glad to be here.
So we're talking about AOMA, Arkansas Osteopathic Medical Association.
Yes.
Tell us what that is.
Yeah, the Arkansas Osteopathic Medical Association started back in the 80s with some osteopathic physicians, got together and wanted to have representation with not just fellow colleagues, but also in the state's decision makers, lawmakers, and the government agencies, as well as the hospitals, as they were trying to gain privileges at each individual hospital. At the time, there was really interesting because there was a little bit of a transition where there was more than just MDs that were doctors that provided medical care to patients. And that included DOs. And the DOs, or osteopathic physicians, wanted to form a group, a professional society, which is what the AOMA has become. And that professional society's main purpose is to support the physicians that are in practice so that we can continue to have unrestricted free practice rights in the state, and also support each other as far as gaining, as far as medical technologies that advance, and we can gain support for each other. And as these new ideas come out that need to be integrated into our medical practice, that we can do that efficiently and safely.
And tell us what the mission of the organization is.
So our mission is we are a voluntary professional society that exists to promote the causes and purposes of the osteopathic profession in Arkansas. That can change over the years, but that's our primary goal so that we can adapt with the face of medicine and new medications and new procedures that come out.
And how does it differ from other medical associations, and why is it important to have one for osteopathic specific information?
So our osteopathic medicine it differs in some of the philosophy teachings, the way that the schools are founded on. And so those professional societies, any professional society, should represent the interests of its members. We are actually an affiliate of the American Osteopathic Association, AOA, and we take their same interests and the same principles that govern them to the state level as far as what the individual practicing osteopaths in this state do and need.
There's a conference coming up. Tell us a little bit about that and some of the key themes for this year's event.
Yes, that's one of the main things we're excited about is our annual meeting. We get together. We have an opportunity to see old friends. That's part of it, is just the social side of it, being able to relate over common patient stories and learn from each other's experiences. But we also are very proud to have an education focus with our foundation as well as our association. Our focus this year is going to be more structured than in the past, where we have actual themes of each lecture series. So we have a theme on innovation in medicine. We, of course, have our OMM, our manipulative medicine theme, which is exciting. And we also have a teaching section, since there are two medical schools, osteopathic medical schools in the state. We have a lot of physicians in practice that actually are precepting students and residents. So we have a section of our meeting dedicated to how to do better and how to reach these students. And there's also a surgical section and a preventative medicine section. We're really excited about that. So it should be a good education time, as well as a time to connect and meet old friends and make new friends.
So what role does continuing medical education play in this conference? You mentioned that it's an important role, an important part for anyone that attends.
It's important. It's also education is one of our core values of our association. That's really one of the primary reasons we exist, not just to educate the students coming up, but also to educate to maintain a high standard of practicing physicians with continuing medical education. There are some minimal standards that each physician is required to maintain as far as hours of education. We anticipate exceeding those, as most physicians do. But we also want to provide low cost for those CME hours, and that's what a lot of this convention is offering is an inexpensive way for our physicians to not just meet their goals, but also exceed their CME requirements and meet some of the specific proper prescribing type lectures and these types of things, which are actually mandated by the government. So we want to make sure we have the highest standards.
And for viewers who might not be familiar, what sets osteopathic medicine apart from other medical disciplines? It is different?
It is a bit different. Most of the difference is the philosophy and how it's taught. The main principles of osteopathic medicine is that the body is a unit. The body is a collection of body, mind, and spirit. And we want to address all these things when we treat patients. One of the other principles is that the structure or the anatomy is directly related to the function and how our bodies move around and organs work well or poorly and vice versa. And so the anatomy is directly related to its function. We also have to really focus on treating things that the body wants to get back to balance, that we call that homeostasis. But the point is that the body knows how to self-regulate. We also acknowledge that, and we teach that everything is interdependent. And so as we develop treatment plans for patients and also make diagnoses, it helps us to understand all these principles. And we also make treatment plans based on these premises.
Where do you see the future of osteopathic medicine heading in the next 5 to 10 years?
So the future of osteopathic medicine here in this state is very bright in the sense that we are going to have a lot of young osteopathic doctors coming into practice. There are 2 osteopathic medical schools in the state that statistically, physicians practice where they train. And so as these training programs develop and students are being trained here in state, there's going to be increased percentage of them that actually stays around to practice. And we want to be the voice of these osteopathic physicians. We want to maintain free practice rights and licensure with the state and federal governments. We also want to be a good voice of representation to our lawmakers. We also want to support each person, individuals that are coming into practice, and make a network of where you send these referrals to when you need this certain specific doctor that is a different field than you're in, or these types of things. When you're taking care of patients, especially coming into a new practice setting, you really just have to use the resources that are available, and you just don't know those until you meet all the doctors. And so this is one of the platforms where you can not only meet the physicians that are in our network, but also we provide a platform for those who are active and want to be active with government relations and advocacy efforts for them to be able to serve. So that's what I love doing it. And there's a lot of others on our board and in our membership that are very active, and they see the value of being part of a state organization that supports our practicing physicians.
And before we go, tell us a little bit about the conference. Where can you find information about it and registration?
Thank you. Yeah, our conference this year is going to be in Jonesboro. It's going to be June 5th, 6th, 7th, and 8th. You need to go to arosteopathic.org and they can sign up. You can sign up from there. There's also social media presence. It's not hard to find us. Just type in Arkansas Osteopathic and you'll find our information. You can certainly, there should be a flyer in the mail that's coming out this week for our existing members. So anyone who's already a member or a recent past member should be getting a flyer that we would love to have you join us. This will be a face-to-face meeting with great opportunities for connection and to see what's the future look like and how to engage all these young physicians coming out. We really want to include anyone who wants to be part of our advocacy efforts and really take this to the next level as far as visibility. And we love our profession. We love the training that we received, and we think it's a really great way to practice medicine. And we want to serve not just our physicians, but their patients. And that's really the mission of our entire organization, is supporting patients through supporting their physicians. So we're really happy to be part of that. ARosteopathic.org is our website. Get signed up. We'd love to see you in Jonesboro.
Well, Dr. Moore, thank you so much for joining us today and sharing this important information.
Thank you very much. I appreciate all your help.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.